experience from Nigeria, and it's good that we live and we engage on things like that. So looking at the last report by the Federal Ministry of Women Affairs and also in conjunction with the United Nations, it was discovered that we had about in Lagos State. Lagos State is the commercial capital of Nigeria. We had about threefold increase in number of calls when it comes to issues of violence, because for Lagos State, they are able to build a gender-based violence response hotline to address that. But for generally across the country, we had about 56% increase within 2 weeks. Within 2 weeks of the lockdown, we had that's 56% increase. And we had cases whereby we had even incest so bad, because when family members are together, so unfortunate that we had that, because there was nowhere people could go. Where we have families, sometimes because of the poverty in our land, we have families sleeping together in the same room. They don't have opportunity to share rooms, so you had incest. We also had landlord and tenant assault, because we get to a point whereby you cannot pay your landlord. So we had issues of assault, and we had even cases whereby people had to use sex to get either to pay for their rent, or even to probably get some food or whatsoever. So unfortunate, but that's what we found. And we also had issues within even domestic violence between husband and wife. And that was a major concern we had, because we had also a kind of, we call it golden nugget. We had to use radio to engage, because since we could not have physical contact, so we started what we call golden nuggets on radio. We worked on issues of ending FGM. We worked with Global Media Campaign to end FGM, and also worked with some other partners, where we call it golden nugget, for people to know the essence of some of these harmful traditional practices and why it should stop. We also use that to chip in anybody. If you are out there, if you are going through domestic violence, let us know, let us talk to you, let us engage with you. And we had some couples of calls. It's so unfortunate that what happened most of the time with pandemic situation like Nigeria is that the income was strained. When you have family income, you have strained income, source of income. There's a lot of agitation. There's a lot of aggression. So the slightest spark on the man, everything goes off. And we had cases like that. So what we had to do was that we kept on following them on phone, because we could move around. And that was another thing I also feel that we need to look at when it comes to lockdowns. There should be a provision for gender-based
that came along with it. When we talk about violence against girls and women, because there was a lot of stop to social activities, or maybe schools were closed. A lot of girls were enclosed in their homes and were sexually abused in some sense, because there were reports that were coming out to say we had a high rate of girls that got pregnant during this period, of the pandemic and the lockdown. And so such issues really had an effect on a lot of social activities. A lot of girls could not do what they usually do, maybe outside their homes, as compared to confined to their homes, where they could not go to schools and things like that. And so bringing it also back to the work that I do with young people in terms of them running radio shows that are focused on different thematic areas around communities, it was difficult for them to physically go into radio stations to actually go and produce these shows. And also, they could not get a chance to get into communities and do the kind of outreach work that they usually do, where they go to interact with local facilities like healthcare facilities and things like that. So it was really a challenging time for them all, not just, concentrating on maybe the girl child, but also the boys that are also working in this field. So those were some of the challenges that we have been facing as young people during this
pandemic has had a very significant negative significant branch on women and girls. And when we look at some of the challenges that we've been having, we're looking first at the biggest challenge being economic inequalities. At the onset of the pandemic, people lost their jobs because of the uncertainties, and also because people had to work, companies had to effect things like the social distancing. Some people, the travel, the hospitality and the service industries, the visitors and the tourists stopped coming in. So most women had reduced income. And of course, with reduced income, most women were not able to meet their daily needs, that is food, shelter, and clothes, and basic needs for their children. And also, with the onset of the pandemic, we saw lockdowns and we saw people staying at homes and reducing the interactions, and that also led to issues like GBV. There was a spike in GBV, a 35% spike rate that was recorded by the Ministry of Public Service and Gender Affairs. So a lot of women underwent GBV, some in very extensive circumstances, some actually died, some were injured seriously. So that was a very big issue. And also the issue of retrogressive culture such as FGM. Now that the children were home and it was uncertain on how long they would be home, some of the parents and some of the grandparents and their communities, they decided to go back to their ways. Things such as FGM happened a lot. There was a spike in FGM cases, although there was also similar crackdown to that, but there was a spike in that. There's also a spike in teenage pregnancies because most of the children were home and the parents were busy looking for ways of earning income. So some of the children were unfortunate to become pregnant in their teenagehood, and other cases of early marriages. Some of the parents who could not bear the brunt of feeding their children because of reduced income married off their daughters, because with marriage comes the bride price, and some parents were willing to exchange bride price to feed their other children. So those are some of the challenges that you are able to see. And also in the SRHR sector, most of the women were not able to access the hospitals for things like immunization, family planning, gynecological services, things that affect women on a day-to-day basis, because the hospitals were not concentrating on attending to COVID and the issues surrounding COVID. The government had to prioritize between COVID and these other issues, and they prioritized COVID. So most of the women missed services. Most of them were unable to receive their SRHR services, and that had an effect, of course. If somebody was not able to access family planning, it had an effect on their family. If somebody was not able to take their children for immunization, it also had an effect on their lives. So those are some of the challenges that we have seen in the country with the onset of COVID-19. Thank you.
Thank you so much, Warima. And I think that's similar to what we have seen in, like you said, Somalia, Tanzania.
Some of the challenges that we've faced here in Kenya, just like my colleague had said, there was a hike in teenage pregnancies, the rates of gender-based violence. And what I would love to add is that COVID came with loss of jobs. There were long holidays due after the lockdown. And then the lost jobs, everyone is at home. So the long holidays mean the kids, high school girls, primary school girls are at home, which exposed them to a lot of free time. That meant that these young girls and the women that are now at home had to face issues to do with violence due to the hard economic times. So I would say that is the hard economic times really boosted the gender-based violence rates. and the IPV rates as well. Also, we experienced people being evicted from their homes during the COVID period. That means that the girls and the women were exposed to diseases, to crime, to drugs, and then, exposure to crime and exposure to drug and alcohol abuse mean that the women and girls were vulnerable to diseases like they were exposed to sexual abuse, to rape that comes with STIs. Yeah.
And in my time as working in these projects with Athena on the What Girls Want and with Plan International as well, challenges that we witnessed with adolescent girls and young women include stigmatization. So it was with HIV when it was first known, and when it was not so broadened by then. People shunned to speak about HIV, same way it was with COVID. When COVID-19 came into the scene, adolescent girls and young women were not free to speak about it. They would not openly disclose their status in my country. And that also caused a lot of harm on adolescent girls and young women. Aside from that, we have continuous information gaps, because now adolescent girls and young women cannot meet, for instance, in adolescent friendly corners in the hospitals and in schools because of the campaigns that we have. So in Zambia, we currently have the social distance campaign going around, of course, to ensure social distancing and the masking up and the like. But with this social distancing, it caused a lot of gaps in access to information as well as services for adolescent girls and young women. And like Mututulelu mentioned, the teenage during the time also saw an increase in undernutrition for children, because as a result of these teenage pregnancies, most of the young girls would end up with children whom they're able to take care of financially. And thus, we've witnessed a number of malnutrition cases for the young children. And also, deteriorating economic status of the COVID-19 impact in Zambia has led to adolescent girls and young women also become exchanging themselves for financial favors. So we term it in Zambia as seeking less, as they are called. So these young girls and adolescents would go out to seek financial favors to elderly men in exchange for sex. That, of course, leads to increased HIV and STIs, infections, and the like. So that's about the challenges that we faced in our work. It's been a challenge to meet up with people to speak about.
These are the places that we actually start when we talk about change. Khadija. So I am Khadija. In 2020, we got news about a 5-year-old girl who was allegedly sexually penetrated on and also strangled to death. Sierra Leone is a country where it's one of the worst counties to be a woman and the mother. That's plain, like that, I can stand to that fact. So when we had an issue like that, the COVID again was just starting to, restrictions were in place, government was very strict. And for us, it was more about, we were more concerned of the fact that sexual and gender-based violence was killing our women and girls more than COVID-19. So it was really, really a serious issue for us. And we came out, we tried to go out on the streets, try to just speak out and let whoever is supposed to take decisions around those issues knows that young people are no longer going to be silent and we need answers. So we went on the streets. That happened in last year, 2020, July. 1 month, 2 months, we're on the same, back and forth with the advocacy. We had, of course, issues with the government because when you talk about sexual and gender-based violence, I think it cuts across in all African counties where you have leaders who are not only perpetrators of these violations, but they support it. So it's very difficult, first of all, for us to say, okay, we want a police clearance. Like they were claiming that for us to go out and just speak out like we need a police clearance. That was a challenge that we faced. And of course, we also, again, like the Black Lives Matter, how it happened, police brutality, police just thinking that because they have the power, because they are in that uniform, the uniform that you are supposed to protect us, young people, citizens. They did not only arrested some of us, they also locked us up. It was a whole hassle back and forth. That, of course, was just a tactics. It was just a strategy for them to make sure that, it just broke our zeal. But we kept on pushing. And then the case eventually went to court. And that is a really long story along that timeline, really long story. But in December, we again revived the whole campaign because it was just silence throughout that time from August, September, it was just silence, complete silence. Information was only accessible to those who were privileged. So we talk about lack of information. This is something that really is a challenge, not only in terms of advocacy, but in terms of also dealing with sexual and reproductive health rights. These information were only made private. And in December, we decided that this girl was still not yet buried. Her body was still in the mortuary. And her dad, who at that time, he came and he showed us that, he told us that he was ready to get justice for his girl. And he asked us to join forces with him, to use our voices, to join forces as an advocacy group. We were really, really, really concerned about that, considering the fact that, you have to be very careful. You have to be very careful when you talk about these issues and you include family members into it. So that again was a bit of a challenge as young people trying to get justice, but at the same time, looking at the dad who wanted justice for his daughter and asking us to join forces with him. We were successful with that campaign because 2 weeks or 3 weeks later, Khadija Sako's body was released to her dad for burial, and the burial was organized. But at the end of the story of Khadija Sako, well, not the end of the story, where we are right now is the point where, Alima, I think you also share light on that.
We don't joke with the power of communication. I always say this, communication is all about me, it's all about my life. And I just want to see how we can get the word out. And so what we tried to do, which also was some of the best practices we engaged in, was to get the word out. And sincerely, we had a lot of people getting in touch. They wanted one assistance or the other. And even coincidentally, we even got some messages, some inquiries even from South Africa, even all the way from South Africa. We had cases whereby people had challenges. They had STI, they had STDs, and they were scared of going to the hospital. And they felt that once they get to the hospital, they are going to be infected. Because that was the idea that was given, that the hospital is the haven for COVID. And we have to tell them, no, once you go there, once you are protected, once you use what you need, once you are using your basic protection, there's nothing like that. So number one, we need to get the word out. And number two, we need to also use what people like. Like get them where they are. And that's why I like what you use. You use the power of animation, use the power of visuals, because visuals is what will work now. People are tired of text. People are tired of talk. People want to see things working. People want to see things in action. And that is one of the things also we had to do. We had to bring in young people. We have what we call the Young Media Advocate Academy. What we're trying to do is to see how we can use
the power of the media, radio programs, and that's why I like my sister that is also doing something like that. I wish that we look at other areas of collaboration using the power of radio and also the power of social media to engage people. And one thing that is also very important is that we need to involve the boys. We need to involve the men. I believe so much in the power that we need to, because one thing again is that from a male perspective, we try to make boys to know that we are not fighting. You know, gender equality is about collaboration between a male and a female. For example, tomorrow now, I'll be going to one of the boys' schools to engage with them because May 16 is the International Day of the Boy Child. And what are we doing? We want them to know that you need to see how you can protect our women, how we can protect our girls. And that is one of the things we believe so much in. And these are some of the things I think we need to. So let's not leave the men out of it. Let's bring them into the equation and let's see how we can work together as one and build a better society. So these are some of the practices. And I also advise for policymakers, please and please, anytime there's any announcement, anytime there's any proclamation, any rule from the government when it comes to COVID, we pray that we don't have a major wave. But in case we have it, make sure you put in gender-based violence perspective into it. Give special preference for gender-based violence victims so that they can be able to have access to help. Because sincerely, I won't lie to you, as what my sister said, and also you mentioned that the hospital were overwhelmed. Most of the health workers were focusing on COVID. Nobody was talking about the issue of violence. So we need to see how we can give priority. So as we are saying, okay, there's lockdown, people cannot move up and down. Please give a caveat like, okay, in case you have been abused, these are the places you need to go to. Let the government be in charge.
Very much, Elimati. And I really like what Ireti was talking about, when we talk about equality, how it is very important that there should be an inclusion of boys as well in the, equality agenda, both boys and men in this. When we talk about the solutions, I think one of the things that could have, first of all, potentially happened with our situations is that we needed to be prepared. I think there was a lot of lack of preparedness in terms of how the pandemic was handled when it just first came. When we talk about messaging, when we talk about just how people were receiving these COVID-19 messages, I think there was a lot of misconceptions and a lot of people did not really understand as to what we were facing in that moment. So there was lack of preparedness. And one of the solutions that really came out was innovation. I think innovation really helped in some sense, because earlier on I had talked about how our young people had, challenges with physically going to these meetings where they could go and, go to maybe in a radio station, set up, talk about issues that affect them. Physically, but then we needed to find ways and strategies of how we can keep this going. If young people are going to talk about, COVID-19, or are they going to talk about, access to SRHR in COVID times, we still needed to find a way. And so my team and I actually managed to do this by engaging our young people in using technology to produce these shows from their homes. And so it was just a matter of them, creating content that would then be put together and be played on radio and still do their advocacy, even in the time of COVID-19. And this really worked out pretty well, because a lot of them were home, bored, and couldn't do, didn't have any social activities going on. But whenever they would sit with their recorders in their homes, or even just using a mere phone, and create content of what was happening around their communities or their families in terms of COVID-19, in terms of other issues that affect communities and young people. This is something that really, really worked. And also, I think the kind of messages that we were getting, even at the beginning of COVID-19, there was a lot of communication of young people thinking that they could not actually get the virus. And I think this was also very common around here, where young people were thinking, oh, it should be, older people that have underlying issues, or it should be people that, in certain jobs that would get the virus. But as time went on, we saw a lot of young people actually getting the virus and being affected by COVID-19 in ways that they never thought they would be affected. So those were also some of the messaging that we're not really, speaking to young people and making them really understand this fact that everyone can actually get the virus. And maybe another solution that I would talk about is still taking it back to technology. I think technology really played a very big role in terms of keeping people together. For myself, I can't even count the number of meetings that I attended online that were, in different, topics and different thematic areas. I think this was because before this, pandemic, I think, especially in Africa, we didn't think that we would use technology this much as compared to how we got to use it in terms of, attending meetings, in terms of working online. Even our line of work now was brought online. We needed to, find strategies of how we work with people online and how we send the messages out there online.
In line with the COVID-19, I think the following interventions, if put in place by our leaders, thank goodness Petraida is listening on behalf of the African Union. At least you can speak, relay this message even to leaders on that platform, as well as everyone represented here. At least you'll be able to share with your different governments. But in Zambia, I believe these would work. For instance, would need to improve policies and advance more meaningful youth participation. So if we have more youth engaged, of course, at the front line, of course, in how we're going to deal with COVID-19, this would help. There is need, of course, to enhance our national development.
We're doing here is encouraging the intergenerational dialogue between the young people and the old people on matters gender-based violence and sexual reproduction health. Because when we sit down with as a young person sitting down with those that are older than us, we get to understand the issues that they went through at their time and how they see things now. And for us young people, we are able to explain to them how we view things. And this way we are able to be more open to our parents. Talking on behalf of teenagers now, we are able to be more open to our parents and tell them the issues that we are going through, and that way they'll be able to guide us on they're able to guide us on ways, on things that we can do to avoid getting ourselves into trouble, like getting into sexual and drug abuse or any other form of activities that may get us getting unwanted pregnancies or the STIs. And also the same encouraging the same intergenerational dialogue will also help open up on matters FGM, where the elderly will be able to explain to us how they viewed FGM back then and how we view it right now, and be able to draw the line between on why it shouldn't take place. And that way we encourage both the young people and the old people to fight against ethos like FGM, like early marriages and teenage pregnancies. So I feel like we should have a more in-depth discussion between the old and the young people, come together. And that is what we've been, there's a program in Kenya called Kenya ni Mimi. It's a youth-led platform where these discussions are being encouraged between the old people and the young people, and they are all in an effort to fight against teenage pregnancies, female genital mutilation, and early marriages. And I believe it will work when we encourage everyone to talk about these issues instead of having the old people talk about them on their own and the young people on their own. Integrating the two ages will be a key.
Alimatu, and thank you everyone. I was really excited to be part of the session and was following up the discussion. And I think right from the start, just to hear about everyone mentioning about the need of media to be prioritized as an advocacy tool, how well can we champion for different initiatives, and hearing from the story from Dieka and the hashtag, I think it traces down to what we similarly supported last year with Namibia, with the Shut It All Down campaign that was aiming to target issues related to gender-based violence. So as most of you know, that we have the outgoing AU Youth Envoy, and we still don't know when we're going to have an African Union Youth Envoy, but the whole call will be announced. But currently we are working as a Youth Advisory Council member to support the initiatives in the office, just to enable it to run while probably they're also finalizing our mandate to that role. Ideally, we have worked on countless occasions, especially to tackle issues related to gender-based violence, FGM being the top of the agenda, with most of the support being offered by UNFPA. We had the Salima Youth Ambassadors, which are actually 6 FGM ambassadors from Africa and 1 representing Africa in the diaspora. Through several submissions that we received, we supported the UNFPA office, the African Union, within that shortlisting processes, and they act as the champions of FGM within Africa, working together with the Department of Health, Humanitarian Affairs, and Social Affairs. But also, I think the African Union Gender Directorate department actually launched the AU strategy on gender and women, which is a 10-year strategy of 2018 to 2028. That would be a guideline document on the priority areas for the AU towards empowering women, and especially the whole concept of gender equality. I mean, it's quite true that within the COVID-19 pandemic, gender issues have been neglected, and this is because the COVID-19 itself has taken the center stage, while all the issues needed to be treated equally as issues of urgencies and things that have to be prioritized. But what I think is the most critical thing that I heard and that we can all do together is just to increase collaboration, increase information sharing. What I heard from Dieka, what I heard from the first panelist, I guess, it all matters on how best we can come down and actually work together to avoid certain initiatives or certain platforms where other young people are doing great initiatives to actually be left behind. Even last year, while we were doing some activities online, we did engage to silence gender-based violence through an open call of a small seed grant support to youth initiatives that are working to end gender-based violence at community level, but also we did some write-ups of stories for young women who are doing exemplary work on ending gender-based violence in general. So what I would really like to encourage, and I think Alimatu, you already mentioned that this is something you're going to take forward on how best we can discuss, is how best we can see more collaboration and how we can all work together. I mean, and the African Union is actually a very open institution that what most people actually think. It's just that when they have information ahead of time. It creates that room for ease collaboration amongst different stakeholders, so as we can all champion the agenda that we are all working on forward. And I mean, sometimes it's quite difficult with the whole internet issues, like today it's Eid, and then we are having a lot of discussions at the same time. But sometimes you really don't have, you can postpone most things, because some discussions have to actually take place so that we can continue the conversation. And I think as the session is also recorded, even those who have missed can be able to view it on later and be able to contribute and see what areas of engagement they can also engage in. So ideally, that's mainly what I wanted to share, is that let's increase more ways on how we can both collaborate. Media has been seen as a challenge, but how can we work together with those who have access to media, when those who do not have access to media at community level, so as we can be able to be that channel? How can we work together to support initiatives like the Khadija initiative that Yeka has mentioned, and how can we actually just unite and do work more in collaboration, because we have a lot of instruments, a lot of statutory instruments, actually documents that have been launched, policies that have been put to place, but maybe some of us are not really aware of them. But once we can work together and collaborate, I think it would be a good platform. And I think we also have the African Women Leaders Network, that actually is also a good network that can be part of, also for other young women to also be part of the whole engagement. So that's all from my side.
Everyone for being here, and let's keep the conversation going. It will never end. We have not exhausted on everything. So this is something we're going to keep on doing again and again.
Day or so, and let's connect and let's begin this conversation to go into our countries and communities to see what we can do, because no one will do it for us. And I think the pandemic has also shown that countries are going to take what is theirs, hold on to theirs. And because Africa has not been hit that hard, though we know there will be an impact somehow, but we can do the change now. We can start the change now. And God willing, we will get there. Thank you so much. Eid Mubarak once again to all our Muslim friends. Have a wonderful evening. God bless you and thank you. And go be leaders that you are.